What scares most plastic surgeons? Well, if you're a plastic surgeon that deals with breast implants, capsular contracture probably really terrifies you. The problem with capsular contracture is it's like the killer in the horror movies. Just when you think you've solved the problem, you're afraid to look over your shoulder because it can come back. Once a patient's had capsular contracture, the chance of it coming back is really high. Just like in the horror movies, the killer always comes back. Now, when you're expecting capsular contracture, like this patient is an older patient, plastic surgery, we expect capsular contracture after 10 years and with time, like this patient and this patient. These patients have had breast implants in for a long time. We expect capsular contracture. It's easier to deal with. But when you have a patient like this, capsular contracture, she's had it recur 3 times in less than 4 years. Her prior plastic surgeon was probably terrified to look over his shoulder because capsular contracture would probably come back and haunt him. So when I saw her, we decided to remove the implants. She had given up on her implants and we did a breast lift with fat transfer. Same thing with this patient. She had 4 prior surgeries for capsular contracture over 4 years. She was terrified of capsular contracture recurring, and her prior plastic surgeon, I'm sure, was also afraid to look over his or her shoulder because capsular contracture always comes back. So with patients like this, where we remove the breast implants and we do fat transfer, and the same thing with this patient, we're not so afraid of capsular contracture because without the implant, it doesn't come back. Now, what if you want to keep the breast implant or you want to keep that breast implant augmented look? We can do things to try to reduce the risk, but it doesn't always eliminate the risk of capsular contracture. One thing we can do to try to prevent capsular contracture from coming back is to use a funnel or a no-touch technique with the new breast implant that's placed. The other thing we can do is use antiseptic solutions like betadine to bathe the breast implant in before we place it. And sometimes, like on these patients, we'll take the implant out from the pocket and we'll create a new pocket. If it's below the muscle, we go above. If it's above the muscle, we go below. And sometimes creating that new pocket helps prevent capsular contracture. But whenever you put a breast implant back in, no matter how you do it, there's always some paranoia that that capsular contracture can come back and haunt you. So one of the benefits of removing breast implants is you no longer have to worry about capsular contracture and you can sleep safe at night. Make sure to talk to your board-certified plastic surgeon to discuss your best options to deal with capsular contracture should you have it.
All this talk about capsular contracture is making me hungry.